my fellow Americans, ask not what your country can do for you. Ask what you can do for your country.
I have a dream. My poor little children one day live in a nation where they will not be judged by the color of their skin, but by the content of their
Don't
character.
tell me words don't matter. I have a dream. Just words. We hold these truths to be self-evident, that all men are created equal. Just words. We have nothing to fear but fear itself. Just words. Just speeches. Don't tell me words don't matter.
All the rough places will be made plain, and the crooked places will be made straight, and the glory of the Lord shall be revealed, and all sight shall see it.
Every time you go to the doctor or to the hospital, you have a set of procedures that happen to you, and it's pretty much every single time. And they go in there, they ask you your name, they weigh you sometimes, they take your blood pressure, your pulse, your respiration, and your temperature. And these, you may not realize it, but those are your vital signs. And they are just that. They are vital to your health. And they give doctors and nurses a gauge as to what the status is that you're in, basically. They're a measurement of the body function, a set of statistics, and they're determining whether you have a treatment that's being successful or not, and also a guideline for good health, basically. The types of vital signs that there are the blood pressure, the pulse, the respiration, and the temperature. And sometimes in some settings, like the hospital that I worked at, they did what was called pulse oximetry, and they put this little thing, which is in that picture, on your finger, and it'll tell you the percentage of the hemoglobin in your blood. So that's a factor as to if you're getting enough oxygen, basically. Blood pressure, that is the hydrostatic pressure that is created by the heart. The heart contracts and pushes your blood through your body, through the arteries, and then it comes back to your lungs through your veins. And there's two numbers that consist of your blood pressure. That's the systolic and the diastolic. The systolic is the larger number that's on top, and the diastolic is the one that's on the bottom. It's the smaller number. And what that means is the systolic is when your ventricles of your heart are pushing the blood, or contracting basically, and then the diastolic is when they're relaxing. So, and then the normal would be 120/80, or someone in good health. For the sites in which you can measure blood pressure, it's important to be closest to the aorta, which is a part of your heart. It's where the blood comes out first. And so that would be in your body, like right here at the brachial artery. And then also you could take it at the radial artery, which is a little bit lower. Also, there is what's called an orthostatic blood pressure, and that is when your patient is laying down. You do 3 readings: when they're laying down, when they're sitting up, and also when they're standing. And a lot of elderly people have this one done because they get dizzy and pass out a lot, which happens to anyone, really. Doesn't have to be elderly. But so they do this reading to get a better idea of what's happening in the body when they're doing these things. Knowing the history of the patient is also very important. For example, if a patient has had a mastectomy, or if they have a dialysis shunt in their arm, then you can't take any blood pressure or any blood draws on that side. So you need to find an alternative. It could be very detrimental to the results that you get and to the health of the patient if you do that on the same side. So it's very important. Here's just a little picture of some of the major arteries. This side is the more important side, where you can see the brachial artery right over here and the radial nerve bone. High and low blood pressure, those are also very important too. A lot of people nowadays experience high blood pressure, and that could damage your vital organs, such as your brain and your kidneys, which filter your blood. So when you have higher blood pressure, it's like they're working overtime, and it's just not very good. And then low blood pressure is the opposite. You're not getting enough blood flowing through there, so you're losing the nutrients and the oxygen. The process of taking blood pressure, it can be a little bit tricky. If you have a lot of practice, you can get better at it. Basically, you find the patient's, you position their arm first, and it's extended and out like this. And then you find the artery that you're going to be using. And then you place the cuff either here or right here. And it has to be like an inch or two above whatever site you're going to be going for. And then you squeeze the little bulb until you can't feel the pulse anymore. And then you listen with your stethoscope and you release the air. And you have to note, there's two sounds you have to note for. And that's the first clear sound that you hear, and that would be the systolic number that you're going to be looking for, and then the last sound that you can hear. So the very last one before it just fades away. Then that's diastolic. And then you can release the air because the patient's arm is probably going to be hurting a little bit. And record your data with date and time. That's very important. Next is pulse. And that is pretty simple, the measurement of your heart rate, and it's in beats per minute. And the arteries are what you're going to be monitoring in this one, and they have muscular walls so they contract. And those contractions are what makes your pulse, basically. And pulse can indicate heart rhythm and also the strength of the pulsation. Normal would be 60 to 100 beats per minute. And exercise, and anyone who does a lot of cardiovascular work, they usually have a pulse that's very low. Like, it's very common for those type of people to have only 40 as their beats per minute, and they're totally fine. Injury and illness usually spikes your heart rate, so when you're sick, you're kind of working overtime. And emotions definitely can change your pulse if you're feeling nervous or sad, those type of things. And then there is such a thing as white coat syndrome, and that's when people who get really nervous around doctors or anyone like that, they usually just get real nervous and their heart starts beating faster, so it gives an abnormal result for that. And then, I don't quite understand why this is true, but it is. Females 12 years and older generally have higher heart rates than males. I think that probably has something to do with like the menstrual cycle and ovulation and that, but that's just me. And the common sites for you to take a pulse would be your carotid, which is right here on your neck, your brachial, and your radial. So to find your pulse, you just choose which site you like, and you place your fingers a little bit firmly, and you can feel it, feel your pulsations and feel your heart beating. So you want to look at the clock when it's at like an even number for you to remember, and just count and watch your pulsations, and then record, of course. Respiration is the number of inhalations and exhalations you take every minute, and one inhalation and one exhalation is one full respiration. And this is normally a test that's done when you're resting, and normal would be 15 to 20 per minute. Any type of labored breathing or wheezing or coughing should be noted for the doctors, and it increases when you're sick, like I said, because you're working all the time. So this one's pretty simple, much like the pulse. You just watch your patient's chest either go up and down for a minute, or their stomach, sometimes they just breathe kind of funny. And you record it with their information. It's very important. And lastly, we have temperature, and there's different ways that you can take temperature. The most common is orally. You just stick your thermometer under your tongue. I'm sure you've done it 100 times. But oddly enough and grossly enough, rectally is the most accurate. And that means in your bum. And it's usually 0.5 to 0.7 degrees higher, so that's kind of unusual. And in reverse would be the axillary under your arm, and that's a little bit lower generally. But also for babies, they do a lot of the tympanic temperatures in the ear. Just real quick, you just half a second and you're done. And also the thermal, they have a new one that kind of like blew my mind a little bit. You just rub this thing across your forehead and it tells you your temperature. And normal would be 98.6 degrees Fahrenheit. And obviously if you have high fever or high temperature, you have a fever. Low temperature, you have hypothermia. This information I kind of found interesting because I always knew about mercury thermometers, but I never really knew what the big deal was. Sometimes the old school glass thermometers have mercury inside them, and that's a really toxic substance for the human body and also the environment. So I guess they passed a few laws that if you have any of those in your house, you should probably get rid of them and dispose of them properly, because there's such a risk of breaking and just a lot of harm involved there. So vital signs consist of your blood pressure, your pulse, your respiration, and your temperature. And the normal ranges would be 120/80 for blood pressure, 60 to 100 for your pulse, and 15 to 20 for your respiration. And then your temperature should be around 98.6 degrees. And all these things together indicate either your illness or the success of your treatment that you've been receiving. And it's also a good indicator as to if you're doing okay. Thank you.